One of the important component of clinical examination of central nervous system is the examination of cranial nerves. Examination of cranial nerves can be done by checking for integrity of the functions done by individual cranial nerves. What we can see in this image is the clinician is trying to touch the cheek with a wisp of cotton. This is done to see whether the sensory innervation over the face is normal, which is done by trigeminal nerve. Apart from trigeminal nerve, there are few nerves which supply the sensory innervation over the face. So, knowing about innervation of face or any other region becomes crucial to check integrity of any nerve, let it be cranial nerve or spinal nerve. And in this session, we will focus on the sensory innervation of the face. The learning objectives for this session are, at the end of this session, you should be able to list the cutaneous nerves innervating the face, describe the cutaneous territories of the face, describe the area supplied by each of the cutaneous nerve innervating the face, and also describe the anatomical basis for a clinical condition known as trigeminal neuralgia. Let's begin with knowing what are the cutaneous territories of the face. If you draw a line from the angle of the eye to the vertex, this denotes a zone called as 1. Now don't read it as V1 because V here stands for the Roman numerical 5, which suggests trigeminal nerve, the fifth cranial nerve. Fine. So this is referred to as V1 or the ophthalmic zone, the ophthalmic territory. Then, if you draw a line from the angle of the mouth again to the vertex, this is referred to as zone 3, right? This is the maxillary zone. Right? Then, the zone which is left over, this is referred to as the second zone or the mandibular zone. Then, there is a slight area over the angle of the mandible which is supplied by the greater auricular nerve. So, this is a separate zone. So, these are the cutaneous territories of the face. Ophthalmic territory, then we have the maxillary territory, and the lowermost we have the mandibular territory. As I said, all points meet at the vertex. Now you might have this question in your mind, why all these lines are looking oblique? Why can't we have straight lines? What happens is, during development of the brain, the skin over the skull or the head is pulled obliquely upwards. This is the reason why these territories, the lines dividing, look oblique. Part of the skin covering the neck is also pulled over, covering the angle of the mandible. That is why you have a small area of the skin over the angle which is supplied by a different cranial nerve. This is how we divide the cutaneous territories of the face. Right? Once we have learned this, let's focus on what are the cutaneous nerves and what area they supply. In order to do this, again, what we'll do is we'll divide the face into territories. Then we will name the nerves. So again, I'll draw a dotted line from the lateral angle of the eye to the vertex, then lateral angle of the mouth to the vertex. So we can extend this line to the tip of the nose. First, let's talk about the ophthalmic zone. What are the cutaneous nerves? The entire face, remember, is supplied by both sensory as well as motor nerves. There is only one motor nerve that we need to remember, which is that the seventh cranial nerve. So only one motor nerve, right? Whereas when we talk about sensory nerves, there are 12 of them. Now let's see if we can identify all 12 of these. Let's focus on the ophthalmic zone. The ophthalmic zone on the lateral side has a cutaneous nerve called as lacrimal nerve. So we will call this as the lacrimal nerve. Lacrimal nerve, as we can see, supplies or innervates the area over the lateral part of the upper eyelid. Then we have a nerve lateral to it. This is the supraorbital nerve. Then we have the supratrochlear nerve. Done. Now these are supplying the medial part of the scalp. If there is a supratrochlear nerve, there has to be an infratrochlear nerve. Then this is our infratrochlear nerve. Now what is this infratrochlear nerve supplying? It is innervating the skin over the dorsum of the nose, close to the root. Then the last nerve we have is the external nasal nerve. External nasal nerve supplies the skin over the tip of the nose and rest of the dorsum. So this is the cutaneous territory which is innervated by the ophthalmic zone. Why it is called ophthalmic zone? All the 5 nerves that I listed are branches from the ophthalmic division of trigeminal nerve. Then let's come back to the maxillary zone, zone 3. Now here what we have is, just below the orbit, we have a nerve called as infraorbital nerve. Below the orbit, so you call it as infraorbital. So this is the infraorbital nerve. What area is supplied by infraorbital nerve? Infraorbital nerve supplies the area below the orbit and also the upper lip. This is regarding infraorbital nerve. What are the other 2 branches in this zone? We have zygomaticofacial nerve. Okay, we refer this to as the zygomaticofacial nerve. And then we have a nerve called as zygomaticotemporal nerve. The zygomaticofacial and zygomaticotemporal nerve come out of the skull through some small foramens and innervate the lateral part of the cheek and also the lateral part of side of the scalp. This is regarding the zone innervated by branches from maxillary nerve. So we have how many nerves now? 5 from ophthalmic division and 3 from what division? Maxillary division. Now let's come to the mandibular zone or zone 2. Now here what we have is, we have a nerve called as auriculotemporal nerve. Right? This is a branch from the mandibular division of trigeminal nerve. As the name suggests, we call it as auriculotemporal nerve because it has 2 divisions. The auricular division, which will supply the external acoustic meatus and the external ear, and then it has a temporal branch which will supply the lateral part of the scalp region. This is the area innervated by auriculotemporal nerve. Then in front of this we have a small nerve referred to as the buccal nerve. As we learnt, this nerve pierces the buccinata muscle, right? So buccal nerve supplies the area over the lower part of the mandibular region. Then the last nerve that we have is the mental nerve. The mental nerve supplies the area over the chin, the skin over the chin. This is regarding what zone? Mandibular zone or zone 2. So how many nerves we have? 3 from mandibular, 3 from maxillary and 5 from what division? Ophthalmic division. So totally we have how many nerves? 11 nerves, all of which are coming from the trigeminal nerve. Which is the 12th nerve then? As I said earlier, there is one small zone over the angle of the mandible. Can you tell me what is angle of the mandible? Angle of the mandible is the area which is representing fusion of the ramus and the base. This area is supplied by a separate nerve from cervical plexus and we refer this to as the greater auricular nerve. Okay? This completes the sensory innervation of the face. You can see how many nerves are supplying the sensory innervation of the face. We have 12 nerves. As I said, the other nerve or the 13th nerve which innervates the face is the motor nerve, that is facial nerve innervating facial muscles. This is regarding the cutaneous nerves of the face and the area innervated by it. One of the clinical significance associated with the cutaneous innervation of the face is, as I said in the beginning, it is essential to do the performance of the examination of cranial nerves. Then apart from that, we have a condition referred to as trigeminal neuralgia, also referred to as tic douloureux. What is this? What is this condition? Now, this is a clinical condition characterized by the involvement of the sensory ganglion or sensory root of the trigeminal nerve. So, this is a clinical condition affecting sensory root of trigeminal nerve. Usually affects middle-aged individuals. Middle-aged and sometimes even older individuals. Done? How this condition presents? What exactly is this condition? Now, this condition is characterized by presence of severe excruciating or lightning type of pain over the face. The patient often winces in pain, producing the twitch of the muscles of the face, which is referred to as the tic. So, the pain comes in episodes. So, paroxysm of the pain, which stays for 10 to 15 minutes and present as lightning or burning type of pain over the face. What aggravates it? What are the aggravating factors? The patient will tell that simple daily activities like brushing the teeth, touching the face, or drinking water, or even chewing will elicit severe pain. So these are the aggravating factors. Now, there are two important trigger zones which will aggravate the pain severely. One is tip of the nose and the other one is cheek. If you just touch over these areas, it will produce severe pain. So these are aggravating factors. And remember the trigger zone. What are the trigger zone? Tip of the nose and then the cheek. What nerves are usually affected? Of course, trigeminal nerve is affected, but with division. Remember this always. The mandibular nerve is the most sensitive. Then, more sensitive is mandibular nerve, and the next nerve we have is the maxillary nerve, and then the next nerve we have is the ophthalmic division. So what we can say, the second territory, the mandibular territory is the most prone, followed by maxillary territory, and then followed by the ophthalmic territory. You need to remember this because this can be asked in your entrance exam. Done? So this is regarding the nerves affected. Why these nerves are affected? What is the cause behind it? Remember this important point. This is due to demyelination of the axons. So demyelination of the axons, which can occur because of hypoxia. Okay? But demyelination is the main pathogenetic factor behind the symptoms. Right? Then how it can be treated? Just remember that this can be treated by ablation of the sensory root of trigeminal nerve, either by surgical removal or by injection of drugs. Done? So this is what you need to know regarding trigeminal neuralgia. Okay? And its anatomical basis. To summarize, the entire skin over the face is supplied by 12 nerves, and we have 3 territories. What are the territories? We had the ophthalmic territory from the lateral angle of the eye to the vertex. Then we had the maxillary territory from the lateral angle of the mouth to the vertex. And then we had mandibular territory and then a small territory of the great auricular nerve. There were 5 nerves supplying the ophthalmic zone or ophthalmic territory. There were 3 nerves supplying the maxillary zone and 3 nerves supplying the mandibular zone. And there is 1 cutaneous nerve from cervical plexus, greater auricular nerve. Why we need to know the anatomy of sensory innervation of the face? It is essential to perform clinical examination of cranial nerves and also to understand the basis of trigeminal neuralgia. We learned that trigeminal neuralgia is characterized by presence of severe burning or lightning type of pain over the face, which is exaggerated by simple daily activities like touch, brushing the teeth, or even drinking water. This is because of demyelination of the nerve fibers present within the sensory root of trigeminal nerve, and the most commonly affected division is mandibular nerve, followed by maxillary nerve, and the least affected is the ophthalmic nerve. This is regarding the sensory innervation of the face and its clinical significance. That's it for this session.